Hello and welcome guys to my channel, the Success Association of Medical Literature. So I am here with a new topic, that is drug presentation. So the drug presentation was on injection fentanyl, not on injection fentanyl. This was not expected to be here. My drug presentation was on fentanyl. So there are various types of fentanyl classification as fentanyl injections, fentanyl nasal spray, fentanyl sublingual sprays, and fentanyl patches, transdermal patches. So this was not injection, drug presentation on fentanyl. So there are various types of fentanyl. Fentanyl is one of the most we can say dangerous drug as well, because it is one of the highlight medication which is kept in double lock, like two lock system. This fentanyl drug is kept in the hospital settings, and without doctor's prescription it is not given, and it is given in very small quantity. If a drop also is given to a patient of fentanyl, so patient may land up into a sedation, that is a type of anesthesia. May further complication or addiction will be there to the patient for this. So this is a double lock, and this is where one of the most highlight medication and most dangerous medication we can say. So college name, drug presentation of fentanyl. Remark: I have got 9.5 marks out of 10 because I have presented my drug in so many well and good method. Submitted to was my dash, submitted by, and submitted on after, right? So fentanyl, we will just go through with the fentanyl injection now. So fentanyl, not the fentanyl injection. Again, by mistakenly I have written here as injection. It is not injection, it is just fentanyl. Pharmacological name is fentanyl citrate injection or nasal spray or transdermal patches. Trade name is Sublimace from 1960s, but now it has came as Abstral, Actic, Fentora, Onsolis, transmucosal, buccal, lingual, lollipops, etc. Classification is fentanyl injections, fentanyl transdermal patches, fentanyl nasal sprays, fentanyl SL sublingual sprays. Pregnancy category of fentanyl, controlled substance schedule of fentanyl. Functional class of fentanyl is opioid. It is a type of analgesic that it affects the central nervous system of the individual. Then chemical class is synthetic phenyl piperidine derivative. Functional class opioid analgesic, chemical class synthetic phenyl piperidine derivative. So this was the starting of my fentanyl drug. Pharmacokinetics and pharmacodynamics. Pharmacokinetics means the absorption, distribution, metabolism, excretion of the drug when it is administered to an individual. Pharmacodynamics is the onset, the peak, and the duration. So pharmacoabsorption, well absorbed through IM, intramuscular, completely absorbed through IV, intravenous. Distribution is unknown because it crosses the placenta. I have given in pregnant women, so it is restricted in pregnancy. Metabolism expensively, leaves 80% bound to plasma protein. Excretion, kidneys up to 25% is unchanged. Breast milk. Half-life means IV 2 to 4 hours, transdermal 13 to 22 hours, transmucosal 7 hours, buccal is 4 to 12 hours. Half-life, a new video will be created for this half-life of a drug. Half-life means if the drug is administered to a patient, so the half-life is a period of time after which the drug will become to half in the body, and it will be dissolved into and it will show its desired effect is the half-life of the drug. Coming to the indications, preoperative analgesia, anesthesia, adjuvant, regional anesthesia, general anesthesia, post-operative pain control, moderate to severe acute pain, use as opioid analgesic supplement in anesthesia. Contraindication, hypersensitivity to opioids, myasthenia gravis, a condition. Black box warning is headache, migraine, astral, lazonda. This all the trade names. Emergency department, respiratory disorder, depression, opioid native patient, outpatient surgeries. These are the contraindications. Like this patient should not be given this drug. Indication, this patient should be given. Precaution, pregnancy, breastfeeding, geriatric, increased ICP, seizures, disorders, cardiac dysarrhythmia, severe respiratory disorders. Black box warning, children, accidental exposure, ambient temperature, increased fever, skin abrasion. This must be precaution. Uses: control, moderate to severe pain, preoperatively, postoperatively, adjuvant to general anesthesia, adjuvant to regional anesthesia. Fentanyl for anesthesia as pre-medication, conscious sedation. Actic for breakthrough cancer pain, also it is given. Dosage and routes: fentanyl anesthetic, adult IV 50 to 100 mcg. This is one of the most important. mcg, it is given in mcg, not nmg. mcg microgram it is given if it is prescribed, not in mg. mg means milligram. If it is given, milligram is also small and mcg is so small. If milligram also it is given, so it may give pain to the patient, like it will give some adverse effect. So it is always and always ordered in mcg, that is microgram. So you can just go through, you can stop with the video and you can just go through the dosage, which is different in different patients, different age groups. Accordingly this, and according to the different classification, that is actic, Fentora, Onsolis, Abstral, transdermal patches, nasal sprays and sublingual sprays. Then available forms is this, are the available forms of that fentanyl. So you can just stop the video and you can just go through this details. These are the routes now. IM and IV, both you can give, intramuscular and intravenous. So transmucosal route, this you can go. Transdermal route using pain dosing, then SL spray, sublingual spray. IV route, storage, store in a light resistance area at room temperature. Mechanism of action, this is again the after administration, what is the mechanism of action of this drug. So you can just stop the video and you can just go through this video, go through this content, that is how it will act in an individual when it is administered through IM or IV route. And I have also given a diagram how it will act on the body, like spinal cord, brain, hypothalamus region, ascending pathway. Then this is the spinal cord, and this is the stimulus, external stimulus, parenchymal nociceptors, wherever it is. And this was the second, cortex, thalamus, then spinal cord, the peripheral site injury. There is an injury to the patient, so it will go through the spinal cord. Spinal cord, it will go to the thalamus of the brain, and then the cortex of the brain. So this is the first. In the PAG and RUM, upward action results in activation of descending pathway. So I've got this very good as well. Upward may also act as peripheral terminal of nociceptors. In dorsal horn, upward inhibits release of excretory neurotransmitter from primary effective nociceptors. Opioids acting on a higher center of brain can reduce effective compounds on pain perception. This is the perception of opioids. Alpha 2 agonist, general anesthesia, modulation, opioid alpha 2 agonist, and MDA receptor antagonist. So this is the mechanism of action diagram, and this is the mechanism of action. You can just go through it once. It will act on the mu opioid receptors in the brain, delta and kappa receptors. This is 100 times more potent than morphine, resulting in an estimated conversion ratio of 1 to 100 to provide an equal degree of analgesia. Analgesia means anesthesia, which is given to the patients preoperatively, so that the during the operation anesthesia is given, then the operation is performed, so that the patient will not feel the pain, and he or she will not sense the feeling of the operation which is performed. So 100 times more potent than morphine, codeine, heroin. These are all the narcotic drugs, high-alert drugs, and from which fentanyl citrate is one of the most high-alert drugs. Now coming to the drug classification, antipsychotics, CNS depressions, then this is the inducers, drug herbs, drug lab tests. These are the drug classifications. Then mechanism of action, this one is in short I have given again. With the uses of this and the adverse effects will be depending upon the systems, that is central nervous system, dizziness, delirium, euphoria, sedation. In cardiovascular system, bradycardia, cardiac arrest. Then ENT, blood, vision, missions. ENT, eye, neck, throat. GI, gastrointestinal system, nausea, vomiting. Integumentary system, rash, diaphoresis. Muscular system, muscular rigidity. Respiratory system, respiratory depression. Side effects, chest pain, discomfort, difficulty or trouble breathing, irregular, fast or slow breathing, lightedness, then pale or blue lips, severe muscle stiffness, unusual tiredness. Then coming to the interaction, individual drug, alcohol, black box warning, diazepam, increased cardiovascular depression, domperidol, increased hypotension. This is the interaction with other drugs. Syringe capabilities, how we have to fill with the syringe, that is injection. These are the drugs. Addiction may be there, addictive capabilities are there, addictive incapabilities, solution capabilities. At last we will go to the nursing responsibility, which is again divided into assessment, family education, and evaluation. So assessment: monitor vascular system after parenteral route, BP pulse, monitor CNS changes, monitor allergic reaction, assess for pain, black box warning, headache, migraine. Patient family education: discuss the changes for children, dangers of children, advise patient to report any symptom of CNS changes, allergies, instruct patient to avoid CNS depressants, teach patient that dizziness, drowsiness are the adverse effect, discuss in detail with patient all aspect of product, teach patient CNS changes. You can just stop with the video and you can just go through this. Then these are the transdermal route. Then evaluation: what can be done. Overdose treatment is naloxone. This is again one of the important, like if by chance it is given prescribed in mcd, that is microgram, but if you have given it in mg, this is the right format, but this is the wrong. But if you are given in mg, what will be the done? Fentanyl you can give a naloxone as an antidote. Like if you in mcg you have to give fentanyl injection, but by mistakenly if in mg you have prescribed, so you don't have to worry about it, and you have to don't be afraid. Like yes, you have to you don't have to do this type of mistake, but by chance if by any mistake this is gone, so don't worry, you have to just inform to your sister in charge, to the doctor, so that they can give the antidote, that is naloxone, to the patient, and this fentanyl's effect will be decreased by giving the naloxone overdose treatment. That last 10 rights of medication which has to be followed by every nurse: night patient, right medication, right dose, right route, right time, right to refuse, right to education, right assessment, right to evaluation, right to documentation. Bibliography, like from where I have taken this Mosby and this website I have gone through. So this was my fentanyl and this was my evaluation. So I have got 9.5 from 10. So overall presentation was excellent, was given by my teacher. Knowledge about the drug and content is good and adequate, need to improve the handwriting. So this was my drug presentation on fentanyl. So thank you for watching. If you have liked, you can just click on the subscription and bell icon for more such videos. Thank you.